Hi everyone, this is Nurse Sarah coming to you to chat a little bit about World Mental Health Day. October 10th, which is today, Monday, is World Mental Health Day. It's an internationally recognized day of awareness for mental health diagnoses. Um, Today, we're specifically going to chat a little bit about major depressive disorder with seasonal pattern. You may have also heard this called seasonal depression or seasonal affective disorder. But just in general, it's estimated that 1 in 8 people in the world live with a mental health condition. In the United States, that number is nearly 1 in 5. So over 20% of people in the US live with a mental health diagnosis. Mental health diagnoses can make everyday life more difficult. They can affect your physical health. They can affect your ability to hold down a job and keep employment. It can affect your relationships with family and friends, and your ability to take care of not only yourself but others around you. From an equity lens, it's really important for us to recognize that social determinants of health can really affect access to mental health care. Socioeconomic status, location, so where are you in the city? Are you in a rural area? That can affect whether or not there are psychiatrists and therapists that you can see to receive services. Level of education, level of employment. So, are you employed at all? Are you underemployed? Do you have access to benefits? Are you being paid a living wage? And exposure to toxins, specifically lead in young people. All of these things create mental health disparities, and this is particularly prominent in communities of color. This just shows how important it is that we're doing this work to address social determinants of health. It's going to help bridge the gaps in this access to care. Again, today we're talking more about major depressive disorder with seasonal patterns. And in the newsletter, you will see that we've provided general mental health resources, calming techniques, and ideas for self-care that you can use not only with your patients on phone calls and in the community, but also for yourself in everyday life. Some quick facts. Depression is actually one of the leading causes of disability worldwide. 1 in 5 people in the United States report that the pandemic specifically has had a significant negative impact on their mental health, with many people experiencing episodes of depression. And that makes a lot of sense, right? Due to the social isolation that a lot of us have experienced, the loss that a lot of us have experienced. It makes a lot of sense that a lot of people are feeling low and having trouble coping with that. Depression is more than just feeling sad or going through a rough patch. And I think that it's important for us to not only acknowledge that ourselves, but also to help reduce that stigma in the communities that we work with. Depression can affect people's appetite, their sleep, concentration, and ability to complete basic tasks around the house. You can see the effects of depression on brain scans. Depression particularly reduces the volume of the hippocampus, and that can affect people's ability to learn and remember things. It also affects other brain structures, both in size and in their ability to, in their processing speed. Major depressive disorder with seasonal pattern is most common in people who live in northern or higher latitudes. It's also very more prevalent in young adults and in women. Some frequently asked questions are, what is seasonal depression? Seasonal depression is a type of major depression that occurs during a specific season. Makes sense. Most commonly, this season is fall and winter. This depression also typically ends when that season is over, which is typically in spring and summer months. Signs and symptoms of seasonal depression consist of oversleeping, overeating, daytime fatigue, gaining weight, decreased interest in sex, decreased interest in social activities, and hopelessness. In severe cases, people also might experience suicidal ideation. Seasonal depression is diagnosed by a care provider. The key is recognizing the pattern of onset and when you're not feeling depressed. So to meet criteria, a person has to have at least 2 years in a row of having depressive symptoms during a specific season, and then they cannot have any depressive episodes when it is not that season. So for example, if a person's depressive symptoms begin in winter and end in April, they cannot also have a period of depression over the summer. And that is how they would meet criteria for that specifier of seasonal depression. Seasonal depression can be treated with a combination of medication, therapy, exercise, and light therapy. Light therapy is really interesting. It uses a light box, which is a special artificial light that simulates high intensity sunlight. And why this is effective is because typically during late fall and winter months, when most people experience seasonal affective disorder, the sun rises later and it sets earlier. So there's not a lot of daylight. And this helps to increase the amount of light that people are exposed to and lifts mood. Ordinary indoor light is not enough to treat seasonal depression, so you can't just use a regular light bulb that you would use around your house. It has to be these special light bulbs. You can buy them on Amazon. They're pretty easy to find if you want one for yourself. And again, I do have resources at the bottom of the newsletter with ideas for self-care. Right now, I just want you to do one breathing exercise with me. If you want to, you can choose to end this video now if you would like as well. But I want you to sit with both feet firmly on the floor, and I want you to take a deep breath in through your nose for 4 to 7 seconds. We're going to hold it at the top for 2 seconds, and then we're going to exhale for 7 seconds. We're going to repeat this a couple of times through, and this is just going to help us to relax, clear our minds, and get through the rest of the day. All right, so situate yourself, and we're going to take a deep breath in, hold it, and exhale through your mouth. Take a deep breath in and hold it. Take a deep breath out. You're going to take a deep breath in. Hold it. Take a deep breath out. And last one. Hold it. Take a deep breath out. All right, everyone. Have a wonderful day, a wonderful rest of your week, and stay well. Bye-bye.